Physician and nurse burnout is reaching crisis levels. A recent study of over 90 countries, looking at more than 2,000 nursing and physician students, found that over half of them were considering leaving healthcare. Many of them were thinking about not finishing their training, or if they did finish their training, not practicing clinical medicine. Now, I know I don't need to tell you how disastrous this is for all of us if we cut back our pipeline of quality doctors and nurses. Next time you or I are sick or we have to go to the hospital, there may not be anyone to take care of us. Now, why is this happening? Well, part of it certainly is still lingering effects from the pandemic, and that burned a lot of people out, and it caused a lot of trouble, which surprisingly is even impacting generations of trainees that weren't practicing during the pandemic, which is quite alarming. But I think bigger than that, there's this sense that the career is too much. It's either too much work, or it's too stressful, or it's just not worth doing. And people are feeling that if they go into it, they will be burned out. The physician and nurse burnout, it's real, and it's spectacular, and it's dangerous. And so what's happening is that different groups now, including medical schools and hospital systems, they're coming up with things like chief wellness officers, for example. And while I applaud the effort, I think it's great that we're, doing things like having some classes on self-care, having some yoga sessions and massage chairs and things like that. I think that's wonderful, but I don't think that's enough. And I think at the end of the day, these future doctors and nurses are going to look into issues like quality of life. They're going to say, well, is it worth doing this highly stressful job when it's hard to change jobs and you have to work all these hours and you have to do this and you have to do that, when I could just become a lawyer or an engineer or a startup founder or something like that and not have to put up with all that stuff. So I think the angle that we need to take, in addition to supporting mental health and providing wellness, is we need to show these young trainees that there really is a great quality of life ahead, but that involves tweaking things so they will have a better quality of life. We need to make the quality of life better for young doctors and young nurses, people coming through the system. We need to show them that when they finish, they can find a job that will match their location of interest, or that will fit the hours more or less that they're trying to work, or that will give them interesting things to do besides just following what some administrator upstairs tells them what to do. I think we can offer concrete, tangible things like making it easier, for example, to move jobs laterally within organizations to work where people want to work. We could make it easier if we give the doctors and nurses projects of interest to them where they can use their skills to improve the medical center or improve delivery of patients through the system. And I think we could make the young doctors and nurses feel better if they didn't feel that they were just overwhelmed by the edicts from the people upstairs who say they have to do this or that when these people have no clinical training. This burns people out. It causes a moral injury where you feel that you've gone to medical school or you've gone to nursing school. You've sacrificed time with your family and with your kids, and you've sacrificed your other dreams. You're not doing other jobs that you could have made more money in to take care of patients, but then you can never change jobs. You can't take care of patients the way you want to, and you're listening to some administrator. And at the end of the day, that's going to have a much bigger impact than an occasional yoga session or a free massage chair. Not that I would turn down the free massage chair, but we need to do better than that. Otherwise, all of this is going to add up, and we're going to have this terrible crisis of physician burnout and nurse burnout, and we can't sit idly by and allow that to happen.